Traumatic Brain Injury and Orthopedic Impairments by Carson Heward and Madison Bankston. Here's a picture of the brain and the different parts of the brain that are affected by traumatic brain injuries. Traumatic brain injury is also called acquired brain injury. It occurs when a student experiences a trauma to the head from an external physical force that results in an injury to the brain. This includes temporary loss of consciousness and is a leading cause of disability and death among children. Orthopedic impairments are also referred to as physical disabilities. Those with significant physical needs include students with cerebral palsy and spinal cord injuries. The etiology, or the cause, set of causes, or manner of causation of a disease or condition, are TBI, which includes falls, bicycle and motor vehicle accidents, sporting accidents, accidents on playground equipment, children abuse, or gunshot wounds. Orthopedic impairments are diseases or disorders related to the bones, joints, and muscles. Cerebral palsy occurs because of injury to the brain before, during, or after birth and results in poor motor coordination and unusual motor patterns. And finally, spinal cord injuries most often are the result of an automobile or other vehicle accident. Prevalence. More than 1 million children and adolescents sustain some type of traumatic brain injury each year. 473,947 injuries result in a visit to the emergency room. Children from ages 0 to 4 and 15 to 19 are most likely to have a traumatic brain injury. 30,000 younger children have a lifelong disability because of traumatic brain injury. 10,000 infants and preschoolers are diagnosed each year as having cerebral palsy. Eligibility criteria. The student has one of the following: orthopedic impairments, other health impairments such as AIDS, seizure disorders, cancer, asthma, or juvenile diabetes, or a traumatic brain injury. The student will suffer with one or more of the following: cognition, reasoning, speech, physiosocial, language, abstract thinking, physical functions, sensory, perceptual or motor abilities, memory, judgment, information processing, attention, and problem solving. Learning characteristics. Traumatic brain injury can be severe or mild and have a pervasive and significant impact on a student's educational performance. Predicting when they will reach their best outcome in their education is impossible. It's hard to teach students with this disability because they appear as if they had not had an accident or have an injury, but they have significant learning and social problems. Many have some abilities they had before their injury, but might experience a loss of capacity. Students might experience problems with initiating and organizing their learning tasks, remembering what they have learned, reasoning, problem solving, processing verbal information, and producing spoken and written language. Depending on the severity, a student could have problems with or limited use in their arms and legs, problems in fine motor movements such as holding a pencil or turning a book's pages, strength and stamina, socially and emotionally, changes in personality, different before their injury, such as they become depressed, realize limitations, or get frustrated with their limitations. Recommended practices involve the family, parents, guardian, in the student's learning. Be sensitive to family stress, but let them be aware of your efforts and their students' homework and schoolwork. Follow a pattern in the classroom. Activities accept consistent types of student responses and keep supplies and materials in consistent places in the classroom. If there is a change in routine, notify your student so they can prepare. You can assign a buddy to your student so they can help when leaving the classroom for lunch, recess, specials, or other things like that. And to be flexible in academic expectations, as they may not retain information well. Another important thing is to be patient. Provide additional examples and exercises. Use strategies to help them focus their attention. Confront them gently about social inappropriate behavior. Help classmates and other students understand their behavior or new conditions, and introduce ways for them to help. Modify instruction according to the outlined IEP. Make the classroom roomy for those with impairments to be able to move around comfortably, such as for students in wheelchairs or students that have walking aids. In conclusion, every child has a different learning style and pace. Each child is unique, not only capable of learning, but also capable of succeeding. And Robert John Meehan said that. So a quick story for you guys. I actually grew up with a guy who had an accident. He was swimming with some friends in a lake, and it was a murky lake. He couldn't see the bottom, and he dove in head first, and it broke his neck. And because of that, he became paralyzed from the neck down. That happened to him when he was only 14, I believe. I was a lot younger than him, but it was really hard for him watching him grow up because he couldn't do the things that other people could do, like playing church ball or going on scout trips. He couldn't go on them because he just couldn't. They couldn't push him up the side of a mountain in his wheelchair. He did have opportunities to go because everyone was willing to help, but it's really hard to see him grow up like that and have that struggle. But I just think it's really important to always be able to accommodate for students that may have disabilities and to make sure that they feel included, because I can't even imagine how difficult it must be to be different than your peers, especially at such a fragile age. So I hope that you enjoyed this presentation. Thank you.